In one of my cases, where it was an 8 to 9-year-old girl who was sexually abused and murdered, in that case, we had collected the soil, grass from the crime scene, the same which was found on her body, in her hair.
Post-mortem or even on the dead body, are there certain signs which the family members could probably pick up to suspect any foul play?
Suppose if it was an old case and I suspect that there was blood in the room and it has now been wiped off, then I need to tell them to spray luminal solution, which is after spraying the solution. If you have washed off the blood for days together or months together also, those red color stains will appear. In the famous Nithari killings in India, where multiple skeletons of small children were found out. So in that case, one needs to separate out all, identify from the bones, the DNA, match with that of the families, and hand over the skeletons.
Hi, I'm Aditi and welcome to a new episode of my podcast, Aditi Shah Talks. Like every other episode where we've been getting experts, specialists and super specialists from different fields. On today's episode, we have got for you someone very special to dive into the field of forensic medicine, which the common man of India is unaware of in certain aspects, which will be covered by somebody who is an industry expert for more than 35 years and has handled one of the most sensational cases in India. We'd like to welcome Dr. Shailesh Mohite, sir. So I'm truly honored to have you on my podcast show. Thank you for taking out time for us, sir.
Thank you.
So in India, whenever there is a crime occurring, and there's crime scene investigation going on, be it at home or outside, what are those important things that the common man should be knowing from a forensic point of view also, that they should also have knowledge about?
Crime scene investigation in India till date was not very common. But now with the new changes in the law, with every offense where punishment is more than 7 years, crime scene investigation has become mandatory.
Okay.
When we do a crime scene investigation, there are certain basic things which we look for. First and foremost, whether the authorization is proper, whether the crime scene is in my jurisdiction or no.
Okay.
This basic point is very important, not at the very beginning, but during the trial stage.
Sorry to interrupt. Authorization by whom, sir?
By the investigating authority.
So the police, you want to say?
But at times it might happen that the crime scene is outside my jurisdiction.
Okay.
To give you an example, in few cases where we have done exhumation, that is digging out of a body, where it was beyond the city limits, we had to have a proper justification as to why the investigating officer has asked me to visit the crime scene. Because at a later stage during the course of trial, at that time, the defense counsel would say that he was not the authorized person to be part of the investigation, and therefore he has tampered, manipulated. So these are the allegations that would come against an expert at that stage.
Okay.
Once I have seen that the authorization is proper, if I have to go outside the city limits, it is not only the authorization by the investigating officer or police, but it is my local bosses, my superiors, whom I have to intimate in a confidential manner, show them the requisition, obtain their permission as well before going to the crime scene.
Okay.
Before going to the crime scene, I need to talk to the investigating officer. What is the case? Whether the crime scene investigation is required in a recent case where the body is at the crime scene, or investigations have been done and now there is a suspicion of foul play, or it might be after a few days or months also. where there might be allegations by the relatives. To give you commonest examples are in cases of hanging, where it might be a case of hanging, but the relatives allege no, he has not committed suicide,
Okay.
but probably someone has hung him. So in that instances, after months also or days, we need to go to the crime scene and investigate.
Okay.
At the crime scene, the body might be over here, but the actual crime of offense might be at some other place, and the body might have been brought and dumped over here. So now in this instances, there could be two crime scenes. Once I have authorized, I go to the crime scene. Before going to the crime scene, I need to make preparations. Preparations in the sense I need to have one or two colleagues with me who would assist me. I need to collect and take material with me like the gloves, filter papers, other instruments, scalpels, forceps, etc. My packaging material, whatever samples I collect from the place, I need to label it, seal it over there at the crime scene itself, and hand it over to the investigating officer.
Okay.
So this preparation I have to do before going over there. Once I've reached the crime scene, I need to secure the crime scene. Meaning I need to cordon off, tell the investigating officer, apart from these members of the team, no one else will enter.
Okay.
It's not always that only forensic medicine. We might have along with us crime scene investigators, forensic scientists.
How are they different, sir?
Forensic medicine are basically medical graduates. Whereas forensic scientists are those who work in the forensic science lab. And there might be toxicologists, DNA analysis experts, there might be ballistic experts. This is how once this team goes over there, we sit, discuss what evidences we are supposed to look for and collect in that case. Once we have gone over there, the investigation would go in a systematic manner. For example, if it is a room, either we start from the periphery and come to the center of the room, collecting evidences on the walls. Both of us go simultaneously. Suppose if we find that the cupboard is open and we need to take fingerprints, then I would tell the forensic expert to collect fingerprints. So he would start collecting fingerprints. Suppose if it was an old case and I suspect that there was blood in the room and it has now been wiped off, then I need to tell them to spray luminal solution, which is after spraying the solution. If you have washed off the blood for days together or months together also, those red color stains will appear. So then we know they need to pick up scrapings from that area. Any clothes which were there of the victim, which have been even washed and ironed at times, those we have collected and we could detect blood stains, seminal stains on those cases also.
Okay.
After having gone through the whole crime scene, the whole room, wherever it is, if it is an open a crime scene, then at least 200 square feet of area in the surrounding needs to be scanned for any weapons, any articles thrown. Because many a time in such crime scenes, the body is unidentified. So we try to find out any identification data that is lying around. If cigarette butts are there, which could have been used by the accused person, so we need to collect them properly for detecting DNA from the saliva on the cigarette butts. So this is how collecting of samples from mud, grass, or even leaves from that. And this needs to be matched with the articles on the body. In one of my cases, where it was an 8 to 9-year-old girl who was sexually abused and murdered, in that case, we had collected the soil, grass from the crime scene. The same which was found on her body, in her hair, that grass and similar mud, which we collected from the accused slippers and his clothes, which were matched together. So when all these three samples were matched from the crime scene on the victim's body, as well as on the accused body and clothes, then we could prove that these two were present at the crime scene.
Okay.
Articles found at the crime scene, whether they belong to the victim or to the accused, is also matched. This is after we have completed the whole crime scene investigation. We then sit down, prepare a report. If the body has to be sent for post-mortem, this report will be of help to the doctor performing the autopsy. So all details, we draw a map, we take pictures, we prepare a list of articles that we have prepared, collected at the crime scene, and hand it over there and then to the investigating officer, obtain the receipt from him as to what articles. While describing, we say, okay, for example, mud collected, how much, in what I have kept the mud, how I have wrapped it, because subsequently at a later date, I will have to identify in the court, yes, indeed, the handwriting on the envelope belongs to me. I have signed. The seal which I have used is my departmental seal. This is how the crime scene investigation at that part is somewhat complete, meaning it will vary upon case to case. Some old cases for hanging, etc., then I have to measure the height from the ceiling to the ground, from the fan to the bed, or any other platform that has been used. Then I have information about the height of the person. So these investigations are then matched. At that time, I already have the PM report, the panchanama of the body, etc. So which I will be able to give opinion. These cases are for opinion purpose. First is a part which I said is about the fresh cases. Subsequent to this, I will have to appear in court at a later date to give my evidence in these cases.
Sir, often people think post-mortem is only to find out about the cause of death of the patient who has come. Are there any other reasons why an autopsy or a post-mortem might be done?
Yes, autopsy or post-mortem, as you rightly said, one of the prime reasons is cause of death. The other reasons being time since death, place of death, meaning death has occurred over here or at some other place, the manner of death, whether it is suicidal, homicidal, or accidental in nature. If there are multiple injuries on the body, out of this, which one is the fatal? One, for example, there might be a cut throat and there might be 10, 15 small injuries on the body. So, which is the fatal injury? Because there might, again, is one to identify the number of assailants who could have been there. If all 4 or 5 assailants are using different weapons, say someone is using a hammer, someone is using a cycle chain, one is using an axe, and one is using a knife. All these weapons will produce different injuries. But someone using the knife who has cut the throat. So I need to find out which injury was the fatal and has led to death of the person. If there are multiple injuries, which is the first injury, which is the last injury? If it is a case of poisoning or even a case of assault, to collect evidences on the body left by the victim, to find out the role of pre-existing diseases, meaning a person who is a heart patient or already has undergone bypass or has got history of a heart disease, in a minor scuffle also, there might be increased blood pressure and intracranial bleed, and he might die. So what is the role of pre-existing diseases in death? If it is a newborn baby, to find out whether it was live born or dead born, how long ago the birth had taken place, how the baby was killed, etc. In cases where a large bundle of bones is found, for example, in the famous Nithari killings in India, where multiple skeletons of small children were found out. So in that case, one needs to separate out all, identify from the bones the DNA, match with that of the families, and hand over the skeletons. The reasons why the list is too long, why we conduct autopsies, and how it helps the investigating officer as well as the families.
Very informative, sir. So, since you mentioned post-mortem, in India, there are a lot of indications, absolute indications where post-mortem needs to be done. Sir, what are those indications where it's absolutely necessary to do a post-mortem? And are there such cases where you can avoid getting a post-mortem done? So can you throw light on that so that the common man should know that this is when a post-mortem has to be done and this is when it needed to be done?
Whenever any death occurs, for legal purposes, for government as per RBD Act, that is Registration of Births and Deaths Act, we require a death certificate.
Hmm.
Now, this death certificate is ideally issued by the doctor in case of an ailing person when the doctor has treated him for at least a fortnight and is aware of his illness.
Okay.
Such a ill person, if found dead and no doctor was there, sometimes it happens that elderly individuals are found in a room where no one has noticed, and body is found after 3 or 4 days when there is offensive odor and neighbors complain. So, in that instances, wherever the death is sudden, unattended, suspicious death, post-mortem is mandatory.
Okay.
Death might be natural because of his previous illness, but if there is no doctor to certify, then a post-mortem is compulsory.
Okay.
There are two types of post-mortems in India. One is a medical or clinico-pathological autopsy. And second is a medico-legal autopsy, which is done under the laws of the state. Now, what is a medical autopsy and where is it done? A medical autopsy is usually done in a medical college. Say a newborn has died. This is, say, the second or third child of the couple who has died in a short span after being born alive. So, in that instance, we are doing autopsy from a research point and to find out what are the anomalies and what precautions the couple should take in future during the course of pregnancy, what investigations needed to be done. One is for that purpose. Secondly is an individual who is admitted in a hospital and dies in a short span of time, where investigations have not come. There was no time to send for investigations, and the treating doctor is not aware about what is the exact cause of death.
So how short?
There is no time frame.
Oh.
Generally, sudden death, there are two schools of thought. One is where death occurs, one school says that where death occurs within 1 hour. The other school says that where death is sudden within 24 hours and cause of death is not detected. But if a person comes with chest pain, sweating, non-hypertensive, and I take a ECG shows that he has suffered a massive myocardial infarction or heart attack. In that case, the cause of death is obvious. So in this instance, even if he is there in the hospital for 10 minutes, giving cause of death is not a problem at all. And in that instance, it can be given.
Okay.
On the other hand, a person is admitted, he might be for 2 days, 3 days, say for example, pyrexia of unknown origin, where you have to rule out all causes.
Where the fever cause is not known.
Not known. So in that instances, to find out the exact cause of death, we need to conduct an autopsy.
Oh.
Or even before, as I told in the previous case, even before taking an ECG, a person with chest pain dies. From the sign symptoms, it is pointing towards a cardiac death. So with the relative's permission, autopsy can be done, initially a partial autopsy.
Okay.
Where only you open the chest, you look at the heart, and you know that there have been blockages. And these are sufficient to cause death. And there is no evidence of any foul play, that is injuries on the body, any poison in the mouth, etc., any signs of poisoning on the body. So in that instances, after partial autopsy, cause of death can be given.
Only if the relatives allow.
Yeah, we require a relative's consent. Now what happens if the relatives don't give a consent? Then we have to inform the police that there is a death and we are not able to find the cause of death. So you register an EDR, that is an accidental death report. Conduct an inquest, Panchanama, and hand over the body to us for conducting the autopsy.
Okay.
Once that is done, then the autopsy is always a complete autopsy.
Oh.
In partial autopsy, with relatives' permission, it is faster. No need of going to the police station.
Yes.
Cause of death which is given goes to the public health authorities for record purpose. But where there is foul play or sudden, unexpected, suspicious circumstances where death has occurred, in those instances, it is very, very essential to inform the police. So, in all hospitals where person is either brought dead or dies within a short span, where or he's in an unconscious state, not able to give history, in that instances, we always inform the police, and the police does a LDR, perform the Panchanama, obtains relatives' statement, and hands over the papers for conducting autopsy.
Okay.
Now there are many autopsy centers in city of Mumbai. We have got St. George Hospital, GT Hospital, JJ Hospital, Nair, KEM, Sion, Rajawadi Hospital. You have got Cooper Hospital, Siddharth Hospital, and Bhagwati.
Only government hospitals.
Yeah, only government and municipal hospitals are authorized to do postmortem.
Oh.
So there is no concept of private autopsies in our country.
Even the partial ones.
Partial ones are only done in medical colleges. So at these centers, autopsy would be conducted.
So, sir, you said that wherever the cause is not known, whether the patient has been brought dead or the diagnosis has not been made even by ECG, those are the cases where it becomes necessary to do a postmortem, and one cannot circumvent doing a postmortem in those cases. So you mentioned newborn also. A lot of times because of the sex, is it possible that the newborn was suspiciously killed? And that become a non-research type of postmortem, right? So that would be foul play. So there it would be an absolute indication, even though the newborn is in the hospital. So in those cases, it becomes absolutely necessary to do a postmortem, right, sir?
Now there are two aspects to it. Many a times we hear, read in newspapers or on TV channels, a newborn was found in a dustbin, thrown at some other place, and he has died. So in that instance, our rule is to find out what is the cause of death, how long ago the child has died, whether the delivery was a home delivery or whether it was a hospital delivery. So looking at the umbilical cord, we would know where the delivery had happened, etc. And then this information is helpful to the police to look out for the culprit mother as to when she had delivered. So it is part of the police investigation they do. So these are unnatural deaths. The first one, which I said, is natural deaths, but their investigations are done to help the couple so that they do not lose their child in future pregnancies.
Even though they do not give consent?
Obviously, when explained to them that this is your second child which has died after a normal pregnancy within 1 or 2 days, the previous reports do not find, but certain hormonal studies, other studies need to be done so that in future pregnancies, all these things can be avoided. So one is from that societal aspect, what we are doing to help the couple. Second, autopsies, which I said, which are medico-legal.
Yes.
In those cases, it is done for the law enforcement agency to catch hold of the culprit.
Sir, on post-mortem or even on the dead body, are there certain signs which the family members could probably pick up to suspect any foul play, which the common public should be knowing that if this is visible, then they should suspect foul play or any suspicious activity?
Yes, first and foremost is where the body is found.
Okay.
Okay, whether in the balcony, whether in the bathroom, in the room, whether the room is locked from inside, outside. Once they find the body, how are the clothes, whether they are deranged, whether the surroundings around the body are disturbed. Is there any evidence of forced entry into the room?
Okay.
Are there any injuries on the body? Are there any wrappers lying around whereby the person has consumed some tablets, etc.? If he has any history of any psychiatric illnesses in the past, any stressors by virtue of which he would try to commit suicide. So we look at those circumstances, we look for, is there any suicide note left? On the clothes, are there any marks of struggle, tears? Is there any foreign material left on the body? Like at times, if there has been a scuffle, then there could be hair of the accused person in the hand. There could be tearing of buttons, etc., and which could be in the hand of the victim. Or there could be tears on the clothes of the victim. There could be blood stains. If he's an alcoholic under overdosage, then there could be vomitus around. Okay. This vomitus could be on the body also, on the clothes also. Okay. So one needs to look for these circumstances. After the common things one should look for, are there any injuries? Is there any cyanosis? Is there any signs of vomiting?
By cyanosis, you mean bluing or discoloration of the skin?
Not only the skin, the lips, the ear lobes, the fingernails. Okay. These are the areas where we commonly look for cyanosis.
And what would that indicate, sir?
That indicates there is decreased oxygen. So it could be suffocation in the form of smothering. You close the nose and mouth, say with a pillow or something. If you have used a soft pillow, or if the person was already unconscious under influence of alcohol and all, where minimal pressure is required to obstruct the nose and mouth. So in that instances, you might not see any external injuries also. Okay. So one has to be very careful, look totally from the
head to toe.
Head to toe, any foreign materials found, any capsules in the mouth, any oozing from the mouth, frothing. These are the other things one needs to look for. Examine the nails. Is there any skin tag, blood of the accused person if there has been a scuffle? Look for footwear. Whether they are just near the bed or one is at one end and the other is at the other end, which suggests there could be struggle.
Oh.
So there could at times a person sustaining an heart attack, he is alone at home. Then he might fall here, there and try to reach the phone, etc. And at that time, the crime scene or the circumstances might be such that they might point out towards foul play.
Okay.
So when you have done autopsy and found out that the cause of death is natural, then all these bits of evidences you can put together, and then you will be able to conclude, no, this, though the crime scene appears disturbed, but this could be as a result of the attempt made by the person to save himself.
Yes.
You might find him in the balcony because he might have gone towards the balcony to cry out for help to someone down. And you might find him in the balcony. So these are the manner in which one needs to look at it.
Also, sir, in cases of poisoning for suicide or even to murder, are there any particular signs visible on the dead body which could indicate possible poisoning?
Yes, one is the evidence of cyanosis, the presence of capsules, powders, etc. on the tongue, on the lips.
Okay.
Any foreign substances, tablets, etc. in the mouth. These are one things. Then color of the postmortem lividity, if it has developed.
What does that mean, sir? Can you please explain?
Yeah, postmortem lividity is the discoloration one would see of the body on the dependent parts. Meaning if the person is lying in a supine position with his face towards the ceiling, then the back is the dependent portion. So the blood gravitates down to the dependent area after death, and this discoloration will be of help. For example, in carbon monoxide poisoning, where he has just turned on the gas and he has gone to sleep, there won't be any struggle. Okay, so in that case, the postmortem lividity will be cherry red in color.
Okay.
And looking at it and the circumstances, one would know that this was a suicidal attempt where he has kept the gas cylinder open, went off to sleep, or he has got poisoned because of the gas. And with 30 to 40% at that time, there is confusion, there is weakness of the limbs. So even if he wants to save himself or call out someone for help, he will not be able to move.
Oh. Sir, in your career of 35 to 40 years as a forensic expert, which has been the most interesting case, or may I say, most interesting findings that you have seen in a particular case?
There are many interesting cases in my career, but I would like to state one where we have worked as forensic expert as well as an investigator. This was a case of an 8 to 9 year old girl about which I mentioned previously also. So this girl was found on the terrace. Now the way for reaching the terrace was through a doghouse. So there was only one staircase by which you could go to the terrace from the room. There was no other way by which you could get to the terrace unless and until you climb the wall.
Okay.
Now this body was brought to us. We conducted the autopsy. Now this girl had gone missing in the night. Body was found somewhere in the afternoon, brought to us in the evening for conducting autopsy. We conducted the autopsy. We gave the cause of death that she was sexually violated, she was smothered as well as strangled.
Oh.
We did this part of diagnosing, keeping evidences. We did the crime scene, collected evidences. The accused was also apprehended, but the accused somehow was not willing to accept that he has committed the crime because no one had seen him doing the crime. So, after 3 to 4 days, the investigating officer happened to come to meet me and said, Doctor, we have interrogated him thoroughly for last 3 4 days, but he just keeps on denying. So I requested him, can I speak with the accused? So they said, yes, fine, you can. So prior going to that, we went through the whole area where he resided, the accused, the victim girl resided, and what had happened, whatever bits of evidences we had, where the accused stays, what had happened in the previous evening, where did he have a drink, etc. The whole path. We roamed around for about 2 hours. Then we went to the accused person, myself and the investigating officer. We gave him a story. I told him that we know that you have committed the crime. The officer told, but these doctors have saved the girl after 3 to 4 days. And the parents are from poor family and they do not want to go with further investigations and they want to move their place of residence. So we said it is a festival time now. If you want to go, you need to tell us the truth. At that point also, he denied everything. Since I had thoroughly seen the crime scene, where it was, then I spoke to him and told him, I'm damn sure that you deny everything, but there are certain things or conversations which have happened between only two of you on that terrace. And obviously that no one else would come to know. So then I repeated him the story as to what happened, where he was standing on the road, how he called the girl, her brother who was there, how he drove him. Then the girl liked Chinese food, so he took her to that cart, packed it, and I said, now you know there's only one road to go upstairs. So I will tell you what. Well, this only you and the girl would know. You climb up onto the first floor parapet, bent down, gave your hand to the girl, and you pulled her up to the parapet, and from there you went to the terrace. Well, up to this is also fine. You might think someone might have seen you at that time. But when you have reached up on the top, where only two of you are there, it is pitch dark, no one else. So what you did is you went and brought one mattress from one corner. Then you sat with her. Then I told him one small conversation which took place with him. And then, Bula, you molested her. And it was not only 376, but it was also anal intercourse which you did with her. And during the course, this was the conversation between two of them. Now, this was just out of imagination what could happen between an accused and a victim. So, certain things which I had told him that hit him, and I said, these only two of you would know. Well, how on earth would anyone else know from which corner you picked up the mattress out of the four corners, where you sat? Now, this was as part of a crime scene investigation. When we came to know that this mat, which is over here, has certainly been picked up from that corner because it had left one pale area over there after you lift the mat out of the dirt. So when I told him from which spot exactly, he started believing something. So we told him that what conversation you told. It is a general conversation. You like this, therefore I've given you this. Now not to tell anyone. All these things. So he believed. He started believing. And at the end, then he confessed to the crime. And so where police officers are tried for 3 to 4 days, here with mere conversation, using the crime scene knowledge properly, he confessed to the crime. We told him, now you better give us the evidences where you have kept your clothes, your chappals. And then he confessed. We told him that you tell the officer, because if you go in that area, people will not leave you. So then he told the officer. He went, collected the evidences. This is one part of the story. When it went for evidence in court of law, during trial stage, after I had finished my examination in chief, the defense counsel, a young girl, asked me certain questions. She said, Doctor, how much time is required for decomposition of a body? In all standard textbooks, it is 24 hours. As I told you, the girl had gone missing in the night. Body was discovered in the afternoon, but still it was in a decomposed state. So I understood what that girl meant. She asked me just one question, that how much time is required for decomposition? So I said generally 24 hours. So she said thank you and she sat down. I knew that this piece of evidence would be used later on during argument stage. That doctor has said 24 hours are required for decomposition. But how is it possible? So I told the judge that I would like to volunteer. Volunteer meaning I need to tell you something so that you understand the perspective of the case. I said generally it is 24 hours, but in special circumstances like summer, body is in a closed room, covered with mud, mattresses, etc., where the temperature is high. So in such instances, body might start decomposing as early as 6 hours. Therefore, it matches with whatever evidences we have. So at times, we need to be very alert in court also while giving evidences as to how the defense would ask questions, where they would stop you. So it is not, forensic medicine is not merely about doing the case, but a lot of homework when you are going to appear in court.
Okay. So if the accused denies doing the crime, then are they let off that way, even though the forensic experts have found evidence?
No, it goes for trial and the court then decides based on evidences.
Okay, even if the parents are not willing to take the case ahead?
Because it is the state who files the case, not the parents.
Okay. Thank you so much, sir, for sharing such gripping information that we all should be knowing about and should be having basic knowledge about, because post-mortem and signs and symptoms on a dead body are certain things which are only seen on channels like shows like CID, etc., from where misnomers and misinformation can always circulate. So, thank you for being an expert and giving us expert knowledge today. Thank you so much, sir.
Thank you very much for inviting me to your show. And I think after 35 years of government service, what basic knowledge needs to be given to the society, I am able to reach through you and your channel. Thank you very much.
If you think we have shared valuable insights in the world of forensic medicine with you, then please do like, share, and subscribe this channel. It's a new channel. We would be grateful for your support. Thank you.